Hello, and welcome to Raising the Bar with the MBBA. I'm your co-host, Adeola Adejobi.
And I'm Jason Clark, president of the Metropolitan Black Bar Association. So this is our first episode where we are doing this virtually as a result of everything that's been going on with the coronavirus, which is actually important because what we're talking about today is some of the racial disparities and the impact of the coronavirus, especially when we're talking about Black and Latinx communities. Today we are very happy to have two terrific guests. The first is New York City Council Member for District 31. We have Donovan Richards.
How you doing?
And who we also have is Acting Executive Director for the Center for Law and Social Justice, Lurie Favors. So thank you both for joining us today. So let's just get started. So Council Member, maybe you can help us by, I guess, setting the stage as to why the coronavirus has spiraled out of control in New York and the United States.
So I'm going to start by saying that it would be very easy. And obviously, we've had a federal government, a president who did not take action as soon as we would have liked to see on this specific issue. But that would be easy to talk about on this specific line, because I think it would be hard not to speak about all of the other disparities that have existed prior to the coronavirus actually hitting New York City in particular. Queens has been hit the hardest, the borough I represent. I was on a line with two of my hospitals this morning who have over 100 people in their morgues as we speak. And when you think about why our community has been hit as hard as it has been hit, you look at the lack of food access. You look at all of the inequities that we've dealt with, low-wage workers, the people who are essential workers, the people who are running this city, even as everybody else who may not be as dark as our complexion is able to stay and work from home. So when you look at the lack of planning on both the city, the state levels, and yes, obviously it's easy to speak to the federal government. When you look at PPE, or the lack of protection for workers on the front lines, these are things that should have been handled many years ago. And, I've been one of those individuals on the front lines calling for more data from the city and state on these specific issues. And I'm happy to say we finally have got some of it, but not even nearly enough of it, because even if you were died at home, the city did not count you until recently 2 days ago. I have not been holding my tongue on this issue because we knew that the disparities existed, and you can't learn those things without numbers. But we knew in our communities, when we see people dying, when we see our neighbors dying, when we see our senior centers directors dying right here in our community, that this thing was hitting our communities harder. So there's a lot to formulate. The lack of healthcare investment for many years. I lost a hospital in Rockaways in 2008, and we have never been able to fill the gap because there's never really been a concerted effort on the federal, state, and city level to make sure we were filling a lot of those gaps. So I think this is an opportunity, and I look forward to talking more today, and certainly thank you to the Metropolitan Black Bar Association for having us today.
Great, thank you, Council Member.
Thank you, Jay.
So another one of the questions, or what actually really where we want to go with this is that, as we've been seeing and as the Council Member was indicating, there are certain communities that have been disproportionately affected by the coronavirus. I believe most recent statistic has showed that 1 out of 3 individuals nationally who have died from the coronavirus are African American. When you look at the numbers for Latinx as well as African Americans here in New York, especially in Queens, the numbers have been bad. Lurie, can you tell us a little bit more as to why you think there has been such an impact on communities of colors, especially as you relate them to other individuals?
Absolutely. So I just want to start by saying thank you to the Metropolitan Black Bar Association for being out on front on this conversation. It really is something that has a particular manifestation within communities of African descent and in Latinx communities. And as was mentioned by the council member, there are a number of historical contributing factors to why it is that our communities are suffering the most from this virus. And they really show up in three primary areas. The first is in healthcare. For over the course of the past 20 years, I believe studies show that more than 16 medical facilities have been closed down throughout the city of New York, 4 of them in Brooklyn alone. We've lost over 20,000 medical beds due to budget cuts in the healthcare system in the state of New York, medical beds that really would have made the difference if we still had access to them. When you're talking about communities of African descent and Black and Brown communities, you're also talking about communities that traditionally are undercounted on the census. So right now, what medical services we do have available to us are essentially being funded on a 2010 census budget allocation. And in 2010, communities of African descent were historically undercounted, as they have been. Latinx communities were also undercounted, as they have been for generations. And all of those factors contribute to what we're experiencing now, in the healthcare space in particular. We also have issues as it pertains to housing. When it comes to the types of environments where this virus really festers, what we see is that your ability to maintain physical distance between yourself and other people really can mean the difference between life and death. And a number of our community members are living in very tight spaces. They are doubled up, they are tripled up in families, often 2-3 families in an apartment that really is only large enough to sustain one family adequately. And literally your ability to physically distance is something that you simply cannot do because your physical surroundings do not allow for it. I often think about what's happening in NYCHA housing right now. NYCHA, which was already underfunded, where families were already dealing with a host of issues, including lead paint, including molding in the buildings, boilers that weren't working, elevators that weren't working. Imagine having to navigate very tight and small hallways, very small stairwell cases, and very small elevators while you were trying to engage in whatever social distancing you are able to muster. If there are 6 to 8 people in one 2 to 3 bedroom apartment, your ability to quarantine should someone actually become ill is also severely limited. And then we have what's happening with our workplace, our enforcement, our employment force rather. There are studies that show that only 1 in 5 of us, that's 20% of us, or people of African descent, have the type of jobs that would allow us to work from home. It is a privilege to work from home. It is one that I hold very dear, but I recognize that for most of my neighbors, working, when you are a delivery person, when you are a healthcare provider, when you are on the front lines as it pertains to being involved in the healthcare industry, when you are a nurse, when you are a social worker, a lot of those positions that are so-called essential have Black and brown faces working them. Everyone who has delivered food on our block is someone who is Black or brown. So these are positions where if you are going to be financially sustained throughout this crisis and you have to go to work, again, likely without the proper personal protective equipment, you are going to be exposed in ways that other communities are not. And so those 3 areas, be it housing, healthcare, and employment, those are the areas where we're seeing really the perfect storm for the increase in coronavirus infections. And we haven't even talked about the prison industrial complex, where many of our brothers and sisters who are currently incarcerated literally do not have access to soap and water on a regular basis. Our state brothers and sisters who are incarcerated at state level were able to make sanitizer labeled with the state of New York's label on it, but they were not able to even use that sanitizer because it has an alcohol content such that it is considered contraband. So we're talking about really in every single area where our communities show up, really a perfect storm of factors that contribute to the spread of this virus in ways that I don't think we have yet to even fully understand.
Yeah, and Lurie, just to touch upon some of the things that you talked about, can you talk more about the census? And obviously, this is 2020. We're going to be counting or getting counted. Everyone should be counted for the 2020 census. Can you talk more about why our communities have been typically undercounted, the importance of it, and what are some of the opportunities that we're missing out on by being undercounted?
Absolutely. So the Center for Law and Social Justice, which is a racial justice law center based at Medgar Evers College in Brooklyn, New York, we created the New York City Black Leadership Advisory Coalition for Census 2020 at the end of 2017, because we recognize historically our communities simply are not counted on the census. And when you think about what's happened in our history, it makes sense that we would be very reticent and not really wanting to give over information to government actors. Last year was 2019. We celebrated the 400-year commemoration of the introduction of the enslavement of African African people into this country. And, you know, 400 years ago, when strangers showed up at your door demanding information, your entire village, your entire community might find itself at the bottom of a slave ship that evening. 200 years ago, someone shows up at your door demanding information and half your family might be sold away the next day. Now, someone shows up at your door talking about we need information, and your child or your loved one might be accused of fitting a description and thrust you into involvement with the criminal justice system or with the child welfare office in ways that can be really violent and traumatizing for our communities. So we have very valid reasons for not wanting to give over information. And then when you layer on top of that the fact that we don't really understand what the census is for, it again is the perfect storm. So the census is really a 10-year survey that the government is required to take according to the Constitution. And that's because in this country, the founding fathers decided that they were going to distribute political power and economic resources based on total population count. So every 10 years, a survey is taken, the country counts every single person in it or attempts to count every single person in it. And once they have that total population count for your community, they literally just feed it into federal formulas for everything for schools, teachers, libraries, librarians to work in the libraries, healthcare facilities, which is huge right now, roads, transportation, senior citizen services, accessoride, every single service that you can think of that our communities rely on. What traditionally happens because of that fear and lack of understanding about how the census operates, our communities are undercounted. We are historically considered hard to count. And that's a label that the Census Bureau put together to really describe communities like ours, communities that traditionally don't show up. So I always give an example. If you live in a community of 100 families, let's call it Wakandaville. And in Wakandaville, there's 100 families. Each of them has one child. And according to the census formulas for that year, every community of 100 families should get $1 per child in education services. Well, if only 40 of those families fill out the census, that means you're only going to get $40 in education services for Wakandaville. But in September, all 100 children are going to show up for school, which means that their school is going to be funded for 40 children, but have to provide services for 100 children. And that is the same thing that replicates itself throughout every single service that our community relies on. So think about how that impacts our seniors and our elders. Think about what that means for our hospitals. Right now, some of the hospitals that are suffering the most are in communities that had a 30-40 census response rate, which means their emergency room beds are only funded at 30-40%. Their access to healthcare providers are only 30-40%. And then you add to that the fact that the census also determines how many political votes that we get. So again, going back to Wakandaville, if 100 families are deserving of 10 elected officials, according to the census formulas for that year, you should have 10 elected officials at City Council and Albany going to fight for you in all your halls of justice. But if only 40 of those Wakandaville families fill out the census, you're only going to get 4 votes, which means when we're fighting for things like bail reform, when we're fighting for educational equity, when we're fighting for proper housing for all people as a human right, we have 4 votes when we should have 10. We're literally short 6 of the votes because we didn't have a full census count. So we're seeing the manifestations of that right now in all of our communities where housing is being cut, where healthcare is being cut, where education is being cut, and literally the city and the state are balancing their budgets off of the inabilities of our communities to fund themselves.
Yeah, so thank you. I'm actually glad that you had you mentioned that, Lurie, because I think that especially when we're talking about this crisis that we're dealing with, making sure that we have the funding to be able to continue our, the work of government and the work that we need, that's going to be critical. I mean, I think I read somewhere where there are over 800,000 African Americans that were believed to have been undercounted during the last census. So that's why I think it's going to be even more important this year with everything that we're dealing with, that we make sure that people are participating in the census. But Councilmember Richard, so, I mean, as we were mentioning, Queens has been the what I've been hearing is New York is the epicenter of the coronavirus, yep, and Queens is the epicenter of the epicenter. Can you tell us a little bit more about what you've been seeing when it comes to people being affected by the coronavirus? And maybe we can start talking a little bit about, what are some of the solutions, or at least some of the immediate solutions that we could be doing right now to protect our communities.
Well, let's start. I think she mentioned some great points. Let's start with the census. Everybody is home. There's no reason that you should not be online or filling out the census because, as there's an old saying, when America gets a cold, Black and brown communities get pneumonia. And it's true here. We're looking at $8 billion in cuts possibly this year. I'll be on a conference call with the mayor and the council when we hang up from this particular chat. And we have to ensure that all of the systematic issues that we've dealt with for a long time are being dealt with. And it's true, when you look at communities from the South Bronx to Southeast Queens to Elmhurst, where we have a high undocumented population there as well, when you look at communities that I represent, like Far Rockaway, there's one common denominator, and that has been the lack of investment in many of the communities that have been impacted the most by this specific virus. So what am I seeing on the ground? We're seeing death. We're seeing NYCHA residents who are cooped up in their apartments because guess what? They don't have the luxury of isolating, because for many, I was born to teenage parents. I mean, there were 7 of us in a 1-bedroom. So if one person has it, has a cold, everybody got the cold. And that's what we're seeing with coronavirus. But the only difference here is that our elders are being given a death sentence here. And what I will say is and this is shameful, and one of the things I pointed out last week to the mayor on a conference call is why aren't our communities being tested? You can't tell us to just stay home all day. Black and brown communities should not be told to stay home all day. We need testing in our communities so that we can find out who has the virus and who is asymptomatic, living in an apartment with their grandmother who's going to be impacted and lose her life over this. So that's what we've been working specifically on with our city partners up to the federal partners, Congressman Gregory Meeks as well, to push city and state government and the feds to make sure that we're doing testing. Let's start there. There was a report, and listen, everybody knows I'm no fan of the New York Post, but the New York Post even put out an article today that white, well-connected individuals are getting more tests than people in our communities. The New York Post. So if that doesn't say enough, we need to ensure that testing is happening in our communities so we know what's happening. And then as the governor and others start to talk about reopening the economy and restarting the economy, who are restarting the economy for? Our communities are going to be left behind, because guess what? I saw reports that all these big corporations are getting the SBA loans. It's not the small businesses in our pockets of the city. And then the city has a grants and loans program, and we need to ensure that that specific program is reaching our pockets of the city as well. So we're working hard on that. But I'm telling you now, this is not only creating a death sentence for our communities, it's an economic tsunami for our communities as well. And we're going to have to continue to work collectively together to ensure that we are pushing government to focus in and concentrate these resources in our corners of the city. So that's what I'm seeing on the ground. I'm seeing death, I'm seeing fear, I'm seeing food lines. I personally went out yesterday, delivered close to 200 meals to senior citizens who haven't even been able to get through on the city's line. So people are hungry. That's what we're seeing on the ground. So we all have an obligation to work together, and most importantly, to make sure we're on the front lines helping our communities. No one else will.
Oh, and just to jump in with another question, Councilman Richards, can you connect the political process to the dollars? Because I think a lot of people in the past just think, okay, well, voting doesn't matter. And they think, okay, they vote and they don't really feel what the effects are because they don't know what that means. They don't know what it means in terms of budgets being reduced, right? Because for them, it didn't seem like there was ever a budget in the first place. So can you connect those things so that people really understand what are some of the decisions that you all are making that are having impacts on New York City, that are having impacts on our communities, and how that connects to the political process?
So I don't live in an alternate reality. You know, I often, when I'm out speaking, and especially during election time, when you try to communicate, whether you're at the supermarket handing out flyers, you'll often get people who say, I don't vote. And I'm like, are you proud of that? You know, numbers matter in this community. Now, I'm fortunate to represent a community that does vote. You know, Southeast Queens represents 40% of the electorate in Queens. So we're a voting community, and it doesn't mean that we still can't do better. But there is a direct correlation between voting patterns and who is paying attention to you. So when you think about the governor, the mayor, and local elected officials, whether they're state and federal, they're going to pay attention to people who actually participate. So our communities have to understand. Now, I've been fortunate enough to really leverage the vote count with my community and resources. So we've been fortunate enough to bring home billions of dollars to our community. But there are a lot of communities that have still been left behind historically because we have not leveraged necessarily voting and leveraging those votes to make sure that the powers that be understand that, listen, these are the things that are important to us. If you want our vote, you need to ensure that you're investing in these specific issues. So I'm happy to say we've made a lot of progress, but we're 50 years behind in a lot of the areas that we're making progress in now. You talk about infrastructure in Southeast Queens, right? I mean, I was fortunate enough to be the first African-American to chair the Environmental Protection Committee for the council. We were able to secure $2 billion for infrastructure for Southeast Queens to fill the gap. Right now, I oversee the NYPD. We were able to do some work around marijuana reform, right? Because my community led the city in summonses and arrests around marijuana. So we've seen those numbers drastically decrease now. So it's very important that, one, you hold us accountable, and I don't run from accountability, but secondarily, that you know that your vote does matter. And just, if you don't think it matters, look at who we have in the White House now. Good luck. Because guess what? If he's reelected and he's part of the problem, we will be dealing with these issues even in a more increased way in the future. So voting matters. Get out and vote. June 23rd.
Right. Well said. And, we actually already only have about 5 minutes left. But I think in the last few minutes that we have, Lurie, maybe you can start us off. What are some of the things that we can learn from this pandemic, so the next time there is a public health crisis, we can be in a better position to make sure that vulnerable communities aren't so vulnerable?
I think that's a great question, because one thing we are sure about is that history does repeat for those who are not able to learn the lessons of the past. We know that from our school education. We know that from the principle of Sankofa, which tells us that you have to look to the past in order to recognize where you are and move forward. And one of the things that's clear is that this has happened before. In the 1918 Spanish flu pandemic, Black communities were the ones that suffered the brunt. We weren't even allowed in the hospitals at that point. Our bodies were not allowed to be buried at that point, and so they brought in Black soldiers to take on that task. And so what we have to be clear about is that the structural relationship that we have to power and to resources remains the same as it has been for quite some time. And I think that we have to be clear that going forward, we no longer really have the option of not thinking about how to, quote, do for self. Because one of the things that is quite clear to me is that if we don't care to do it and no one else cares enough to do it, it simply will not get done. Whether that's looking at how we create and own and maintain and control healthcare resources within our community, whether it's how we explore employing our own community members within our own institutions that are funded by our own dollars. I'm a Gen Xer, so coming up in the 80s and 90s, these were conversations that were sort of academic. And I think what I've seen, as I'm approaching, I'm now the parent of 2 children, and my husband and I have this conversation all the time. It's no longer academic. In order to be healthy communities, we have to, in every sense of the word, we have to begin thinking about how we are able to control the resources within our community, how we exercise that control, how we elect members like the council member to represent us politically, but how we control the economics and the healthcare systems within our spaces to the best of our ability. Because truly, if we don't care enough to do it, nobody else does either.
Yep.
Right.
Yeah.
Great. Thank you. And Councilmember, any final thoughts?
Oh, there. I'll just say that I completely agree. If we don't take control, and it was a valuable lesson I learned during Hurricane Sandy. I got elected the year after, but I was on the ground in the Rockaways during that particular time when FEMA didn't arrive, when the city didn't arrive, when the state didn't arrive, and we literally took matters into our own hands. So we have to organize, we have to own our businesses, we have to control the economics and politics in our communities. And if we do that, we really will be steps ahead in the event of another virus that will come again. Hopefully not in our lifetime, but history does repeat itself, as she said. And so I would say, let's look out for our neighbors. We could talk about all the social distancing we want to talk about, but the bottom line is that PPE needs to reach our community. The testing needs to reach our communities. The resources needs to reach our communities. And this is a real opportunity now with federal dollars now at play to make sure that that actually does happen. So let's keep our eye on that prize. We will have to continue to lobby, and not just elected officials, the community, to push those in power to ensure that those resources now that are coming down from the federal pipeline can reach our communities to expand healthcare, to expand food access, to improve public housing, to build more affordable housing, and address a lot of the systematic issues that we've dealt with.
Can I just say one last thing? Please, 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 please go to my2020census.gov. You can fill out the census online. You can also fill it out at 844-330-2020 if you want to call it in. People should have gotten their paper forms by now, but if anything you can do right now while we're all at home dealing with the Rona, my2020census.gov. Those 10 questions take you less than 10 minutes, and they will determine the funding and political power for the next 10 years of our lives.
And when's the deadline to apply for the census?
You can do it absolutely right now. They've extended their calendar through the summer, but the earlier we get our numbers in, the more likely we are to secure the funding and the political power that we need.
Great, excellent. Well, thank you both for your time. You know, we're very thankful to have for Lurie as well as Councilmember Richard.
This was an amazing conversation. Thank you so much for your time, and thank you so much for watching Raising the Bar with the MBBA on the Manhattan Neighborhood Network. See you next time.